then just releasing both hands down to the floor. The last basic principle to think about with Pilates is our head and cervical position. So we have a natural lordotic curve, so it should mirror the lower back curve, but quite often we have a chin forward posture because of computer work or driving. So the lordotic curve of our cervical neck area can be quite different to the shape of our lower back. Can create a lot of tension if your chin is forward. Gravity wants to pull your head forward all the time. So these neck flexors that are around the whole of the area of the neck are working really hard to hold the head up. And on top of that, if you're a thoracic breather, so you're breathing in the top of your chest all the time, not diaphragmatically in the lower lobes, those poor accessory muscles of breathing are overworking as well, and that's why neck tension can really cause lots of problems. So we're trying to get a position when we do Pilates where we open up the top two vertebrae of the neck, which are called C1, C2, or the atlas and axis. And the way we demonstrate that is what's called a craniovertebral flexion. So it's a small amount of flexion of the top two vertebrae. The easiest way to demonstrate this, or to cue it, is to think of having dots on the ceiling, where you are on dot number 1 at the moment with your nose directly pointing up to the ceiling, and there are 5 dots. If you were to take your gaze to the 5th dot, you would be jamming your chin into your chest quite a lot. If you can come to your 2nd dot, you will get to a point where you just have a little bit of opening of those top 2 vertebrae, like you're holding a small piece of fruit, an orange or an apple, between your chin and your chest, and then you've opened up those couple of vertebrae. So that small little movement of opening and almost squeaking your hair on the floor underneath you to just open up the vertebra is your craniovertebral flexion. So it's a tiny movement. So to recap the 5 basic principles here: breathing, pelvic placement, rib cage placement, scapular movement, stabilization, isolation, and head and cervical movement as well. So just that laying in neutral, giving yourself 10 minutes to get everything in the right position while you're laying on your back. These can all be demonstrated and should all be demonstrated in different positions on the mat or standing. So in a prone position on your front, in a sideline position, or 4-point kneeling, in sitting, in standing. But this just gives you some